Assalamu alaikum. I hope you all are doing great. I'm Dr. Tahir. I am one of the practicing emergency physician. So my little background is that I did a board certification from Qatar. So I have Arab board and I have Qatar board in emergency medicine. On the top of it, I have FRCAM, which is like Royal College of Emergency Medicine Fellowship. And now I'm in the US. I'm doing residency in emergency medicine. So today's goal or idea behind the video is to give you perspective about emergency medicine. Emergency medicine is like progressing and has changed in the last 2 decades greatly, and I would say that is one of the specialty in medicine that is growing and changing fastly because of technology, because of more knowledge. It is relatively a new field of medicine. You will get like more chances to explore it because there is no such congestion or crowding still. Having said that, different countries have different protocols, and it has different way of like practice. But if I talk about Pakistan, so I would say, because I belong from Karachi, so if you go to Aga Khan University Hospital, there you will get a kind of a real feel of emergency medicine, where you get dedicated emergency physicians. Then you get residents, trainees, and they manage emergency department on their own. On the contrast, there are some places still where surgery, medicine, uh, these guys are managing emergency medicine on call basis. But this is not it should work, because emergency physicians are those who have like dedicated responsibility for patients arriving to emergency department. Why is it important for emergency to be managed by emergency physicians? Because they are trained, or their reflexes are built on that. So if because emergency ranges from quite subtle stable presentations to very unstable and life threatening conditions, so you should have that range, or that wide broaden clinical acumen and reflex and response times. So in emergency medicine, usually the training is done on that pathway, that it will prepare you for worst come worst situation, but will also train you to be like very static when it comes to stable patients, so you don't overshoot, but at the same time you know when to shoot. uh, so it goes from like flu, pneumonia, fracture, dislocation, laceration, injury, cuts, bleeding, trauma, road traffic accidents, stroke, myocardial infarction, septic shock. So like there's like whole bunch of diseases that you will encounter in the emergency department. I love emergency medicine because it gives you exposure to all of it. Having said that, there is some feeling that it is not that deep when it comes to like management, but I would say there is a trade-off, because if you see and when you rotate to different departments, you will find that the management that has been done in the emergency department, that's kind of the majority or the major chunk of management that has been done, and then it's just the continuation of therapy, except for like obviously if patient needs surgery for appendicitis, or if patient needs angiogram and possible stenting for myocardial infarction. But even then, the initial management is done in the emergency department. So you get new patients, it's a new day. Every patient has his own disease and his own pathway to deal with. If you're a kind of a person who wants to have a mix and match, then this is the best specialty for you. uh, Other than that, the workflow in emergency department is usually shift based, so you work like maybe 8 hour, 10 hours, or 12 hours shift. But once your shift is finished, you walk out of the door, you are free. There is no responsibility, there's no bar on you, because you already handed over the patients. So if you look at it like at the attending level or at the consultant level, emergency medicine is kind of a very um hassle free, I would say. So again, there's a trade-off. So in emergency department, you get very sick patients, and you deal with patients with no background information, so that is tricky, and that is like sometimes can get difficult as well, and can take you to some kind of legal complications. But on the same side, once you walk out of the door, the patient is not yours, and you are free. You have no burden, or I would say there was no constant stress on yourself that what is happening with the patient. So people who like to have a new day, new patient, they don't like continuity of care or the repetition, then emergency medicine is a perfect specialty for you. In Pakistan, we need to work on emergency medicine to make it as it should be, not the old fashioned or the, I would say, the conventional emergency medicine. Modernized emergency medicine has like a lot of perks, and if you guys start taking interest, then only we can have better workforce. So if you want to know anything more about emergency medicine, then just be like tuned to us and tuned to me, and then we'll be giving you all information about emergency medicine. I'll try to organize few sessions in near future for giving you perspectives in terms of countries, how is emergency medicine in the Middle East, in Pakistan, in UK, and in the US. So thank you so much, and you take care of yourself. Allah Hafiz.